And once you're into your 4th and 5th day, it's amazing. Your autophagy is now off the roof. Your ketone production, of course, is very high. When you break your fast, oh, by the way, your growth hormone levels are really, really high at this point as well. There's nothing better than fasting to increase your growth hormone level. These studies have been done. 2,000% increase in your growth hormone production during fasting. Show me something that can increase your growth hormone by that much. So you take my old patients, right? My elderly patients. I can look at them and I know that they've got some form of adult growth hormone deficiency because they got some sarcopenia, which is weakness of the muscles. They're just old, they're weak. And I wonder if I give them a little bit of growth hormone exogenously, maybe I can reverse this. But exogenous growth hormone injections carries a lot of risk, and it does cause some adverse chemistry in the body. So I don't like that. Anything the nature itself does, the body, is better. Fasting increases your growth hormone. I know that that type of increase in the growth hormone is not going to harm the patient. And I've noticed that when my elderly patients do fasting and then they're exercising also during the fast, they come back with more strength. Now, they don't come back buff. They come back with more strength. So what? Well, guess what? The stronger you are, the longer you're going to live, and also the less likelihood of injury and your ability to recover from a trip and fall. You need strength. Fasting gives you more strength in your muscle. Your muscle will be stronger. You're not going to get buff. Forget it. There's other ways to become buff. So your strength increases. And for me, for all my patients, strength is very important. Your ability to recover from a fall, because you're going to trip. But how come I trip and I recover quickly? Because my reflexes are faster and because my muscles are strong. So I can recover from that imbalance. So this is an important part of it. So growth hormone, very important for me in my patients. So I tell them to exercise while they're in the fasting state to maximize that as well. And then when the fast is broken, when they break the fast, is a very crucial time as well. Because now all of a sudden, all these nutrients are coming in, right? It's a shock for the body, right? All the stuff coming in, the intestines are like, whoa, I got to wake up and got to start doing my stuff again. How do you do it? Well, because of the change in the chemistry that occurred while you are fasting, your body is now hungry for certain types of nutrients. And what are those nutrients? One of them is phosphate. So phosphate deficiency is important. And patients who do the longest fast, when they start eating again, they can get muscle weakness, aches, pains when they start eating again, because all of a sudden they're getting phosphate deficiency. So when they break the fast, I usually encourage them that, hey, go and take some bone broth. See, these are tricks. Sometimes if a patient wants to fast long enough and they just cannot do it, I'll tell them, go ahead and just have some bone broth today. I found that bone broth does have a little bit of calories in it, but doesn't seem to break the fast that much. I'd rather have you do that. So go and get some bone broth. It's full of electrolytes, it's full of glycine, it's full of phosphates. And the patient will be able to break the fast and not go through that, what is known as refeeding syndrome, where they get aches and pains and feel lousy because they get phosphate deficiency. So they'll take their bone broth, and then about a few hours later, they can have a nice light meal. So they can have a salad and gradually get into normal feeding. You don't go straight into a high-protein diet, for example. Yeah. And so I discourage that. So I gradually get into it. And at that point, stem cells go up.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The king of all hormesis is fasting. Doing time-restricted feeding on a daily basis should become part of your life. Stop snacking. It's unnatural. You should only have 2 meals a day in a 6-hour interval.